What happens when pregnant women experiencing depressive symptoms receive a comprehensive supply of clinical-strength prenatal micronutrients? In a recent Child Health and Wellness seminar, Professor Julia Rucklidge, director of the Mental Health and Nutrition Research Lab at the University of Canterbury, shared groundbreaking findings from the NUTRIMUM research program. Her message? Broad-spectrum micronutrients may offer a safe, well-tolerated, and effective intervention for prenatal depression and provide a healthier start for babies. Here is a summary of what the research uncovered. The nutrition gap in pregnancy. Many pregnant women fall short of basic nutritional guidelines. In New Zealand, for instance, only 3% of pregnant women fully adhere to Ministry of Health food guidelines, and internationally, about 30% of foods eaten during pregnancy are ultra-processed. Guidelines help prevent basic deficiencies, but minimum nutrition is not always the same as optimal nutrition, especially when the developing baby is drawing heavily on maternal nutrient stores and the mother's brain needs support for mood regulation, sleep, and stress response. The NUTRIMUM trial, what did they find? To test whether optimizing nutrition could help, researchers set up the NUTRIMUM trial, a 12-week, fully blinded, randomized, placebo-controlled study for pregnant women with moderate depressive symptoms. They compared a broad-spectrum micronutrient formula, daily essential nutrients, against an active placebo. The results were incredibly promising. Participants showed improved overall health, mood, and well-being, along with better sleep and daily functioning. For mothers who had a history of medication use and personality difficulties, a group typically harder to treat, about 75% responded positively to the micronutrients, while the placebo had no effect. The benefits did not stop with the mothers. Researchers also observed the infants after birth, comparing those exposed to micronutrients in utero against those exposed to antidepressants, as well as a healthy control group. Infants in the micronutrient group performed significantly better on early newborn behavioral assessments. They showed better habituation, motor performance, autonomic stability, and state regulation compared to the antidepressant-exposed infants. The micronutrient group also had a healthy average gestational age of 39.5 weeks and a preterm birth rate of just 5.5%, lower than the national average and significantly lower than the expected 15 to 24% rate for mothers with untreated depression or those on antidepressants. One of the most striking findings was the protective effect against postnatal depression. Typically, women who are depressed during pregnancy have a 39 to 92% risk of developing postnatal depression. However, for the mothers who took micronutrients during pregnancy, the rate of postnatal depression dropped to between 7% and 14% at the 6-month mark. This suggests that ensuring mom gets sufficient nutrients while the baby is drawing from her stores can have a lasting protective effect on her mental health long after birth. Professor Rucklidge emphasized that there is no single magic nutrient. Brain metabolism relies on a complex symphony of vitamins and minerals working together. A balanced, broad-spectrum formulation is designed to supply these essential cofactors together, supporting everything from neurotransmitter production to a healthy maternal microbiome. The NUTRIMUM research does not replace the need for comprehensive medical care, but it does highlight a crucial, modifiable foundation for maternal mental health: nutrition. Supplementation with daily essential nutrients, the world's most research-backed, clinical-strength, broad-spectrum micronutrient formula, serves as a powerful proof of principle that giving the brain and body exactly what they need during pregnancy can safely improve mom's mood and give her baby a better start in life.